Doctor, I have suddenly started balding. I was in London, nothing happened to me. I came to Bangalore, something is wrong with this water and I am losing hair. Doctor, as long as I was in Bangalore, everything was fine. I went to London, I have started balding. Something is wrong with that water. Why am I balding? Why are so many people balding? These are the questions which people ask us. And because baldness is so common now, people are aware and they keep asking questions, which I will try to answer today. I am Dr. Venkataram Mysore, hair transplant surgeon, dermatologist, Venkat Center for Skin, ENT and Plastic Surgery, Bangalore. Why do men bald? Do women bald? Do animals bald? Fascinating question. Men bald because basically of two reasons. One is the hereditary factor, two is the male hormone factor. If you don't have the gene, you will not become bald. If you are not a man, if it is a woman, you won't become bald. Both of these are true. To the extent that half the male population by 50 years of age is bald. And men have started balding earlier and earlier. What happens? There is a gene which makes the hair in this area susceptible to the male hormone. It cannot withstand this male hormone. So, when the male hormone acts on it, the hairs become thinner until they disappear. This process of thinning is what is called miniaturization. Until they become so small that you can hardly see them, what is called a vellus hair. You can see here in this diagram how they become thinner, the process of miniaturization. This gene is transmitted from one generation to another generation, but it may be expressed in different generations in different ways. If there are 4 children, 4 boys, one may become bald, one may become partially bald, other 2 may not become bald at all. If there is the gene inherited from both mother's side and the father's side, chances of becoming bald are more. Now the next factor is the male hormone. We all have the hormone testosterone. There is also another male hormone called dihydrotestosterone. There is an enzyme to convert testosterone to dihydrotestosterone called 5-alpha reductase. And this dihydrotestosterone is more potent than testosterone in many ways. But it acts differently in different areas. For example, dihydrotestosterone causes baldness here, but it makes the hairs grow here. And this hair is unaffected by dihydrotestosterone. This is fascinating. And this dihydrotestosterone leads to thinning of hair in a gradual manner. And this enzyme responsible for it is present in the skin, is present in the hair itself, and is also present in some other tissues. So people ask, doctor, if the male hormone is causing it, then the treatment has to be something to decrease the male hormone. I don't want to take it. The answer is simple. There is a drug called finasteride which inhibits that enzyme, but that enzyme receptor are of different types. There is type 1 receptor here, type 2 elsewhere. So this drug inhibits the receptor only in the scalp. So it's called a selective antagonist. So this is the explanation why the drug is good, why the drug is safe. But despite our explanation, many patients often are reluctant to take that drug. Now, why this hair doesn't bald, only this area becomes bald. As I explained to you, this area doesn't become bald because the male hormone doesn't act on that. Why doesn't it act on it? The reason is this part of the skin, scalp, embryologically is derived from a different source called mesoderm or mesenchyme. Whereas this part is derived from a different source called neural crest. They both join together. Because they are from different sources, they behave differently. One balds, other one doesn't bald. Then there is another question, if this is the case, Why beard hair grows so much? That is again because the hormone acts in differently in different areas. This is one of the most fascinating things in dermatology. What about women? Women have more estrogen, less testosterone, less dihydrotestosterone, and they also have an enzyme called aromatase which can convert testosterone to estrogen. But if a woman has what is called androgen excess, for example, polycystic ovary disease, they also can develop some thinning. But they develop thinning, never become bald. Hairs don't disappear completely. Doctor, are these only factors? Nothing else? What about smoking, hard water, diet, stress? These all can be additional factors. Hard water affects this shaft, doesn't affect the root. Stress can cause hair loss. Usually it is temporary, but in a hair which is already weak genetically, if there is additional stress, they lead to more hair loss. Smoking definitely leads to hair loss by decreasing blood supply, by decreasing cell multiplication, and by reducing immunity also. So smoking has to be stopped. Now we come to a very important factor, metabolic syndrome. You might have read about this in the newspaper. These days, obesity is increasing. Young people getting heart problem, blood pressure, diabetes, all these are happening. Why? This is what is called metabolic syndrome. And baldness is more common in such patients. These patients are obese, they may have a family history also. They start losing hair very early, 16, 18, 20. And importantly, they lose hair everywhere, what is called diffuse pattern hair loss. You see this chart here, men become bald either in the front or in the vertex, though in the later stages they may join together. But you see this photograph of diffuse pattern hair loss, it is the patient is losing hair everywhere. And in such patients, treatment of the existing hair is very important. And in such patients, baldness is a risk factor for future development of metabolic syndrome. So they need to maintain fitness, exercise. What about diet? Well, diet is very important. All deficiencies must be avoided. Protein-rich diet has to be taken. But can diet change the male hormone pattern? Can diet inhibit 5-alpha reductase inhibitors, 5-alpha reductase enzyme? There is no proof for this, but if you search internet, there are many videos, many saw palmetto from plant is safe and can inhibit 5-alpha reductase. Curcumin, pumpkin seeds, onion juice. Question is, they may have some weak anti-androgen activity, but is it enough to produce hair? The answer is no. People have tried these things for centuries. They did not grow hair, and it won't grow hair now also. So, when you search, don't be very attracted by this. They are made to influence you, but beyond that, they won't influence the hair. That is certain. For this reason, the male pattern baldness needs a regular systematic therapy. And it has to be taken continuously over long periods of time. It is not for 6 months, it is not for 1 year. I can see here systematic, rotational, combinational therapy for androgenetic alopecia. This is our research publication. So, baldness is a fact of life, but can be treated. It is being understood. Newer and newer treatments are coming. Treatments to regenerate the hairs are coming. Treatment to modify the genes are coming. So we have a good option now and we'll have a better option later. I hope you have liked this video. If you like it, please share it. Visit our website venkatcenter.com. Please send your suggestions. Thank you very much.